So let us begin with Nash therapeutics study streak, and the next group of remedies that we'll discuss are around four remedies actually, and not five. Usually we have taken up five remedies in each session, except a few last sessions where we took remedies in groups of three. So the reason why we pick up four remedies today is because they seem to act well or look well when picked up and learned this way. So the remedies that we'll discuss today are the Kali group remedies, Kali Carb, Kali Bichromicum, Kali Iode, and Kali Mure, and how Dr. Nash has mentioned so beautifully in his therapeutics, leaders in homeopathic therapeutics by Dr. Nash, how beautifully he has given the different differentiation between Kali remedies, each of those Kali remedies and the other remedies which look very similar, some philosophical insights, some cases that he has shared, and some of his experiences, which how he just eloquently writes in a flow of thoughts. So we'll start with Kali Karp, which is the first remedy, and if we read it from Nash, we see that there are two key differences. He starts by explaining Kalika. The first thing that he shares is that there are stitching pains in Kalika. We all know about it. But when you see practically a patient with stitching pains, you will see that there is more or less similarity with the stitching pains of Kalika and similarities in stitching pains of Bryonia. So how will you differentiate? And I have been putting up presentations with my commentary on YouTube, which is going on simultaneously. We are live on Instagram as well, and it is in the form of table. When Dr. Nash has shared about multiple remedies in a explanation of one remedy, it becomes difficult to absorb unless you see in a visual form, which is in a tabular form. That is what I have done over here. We have the remedy Bryonia, which is very similar to Kalika. It also has stitching pains, but Bryonia will have least motion aggravates, whereas Kalika will have no motion. In fact, the pains, the stitching pains are irrespective of motion. So even if the person does not perform any activity, there is a constant type of stitching pain. Second thing, what he gives is sphere of action. So sphere of action, serous membranes are more suited for bryonia, but for Kalikab it is anywhere and everywhere in the body. It can be joints, it can be lungs, it can be hands or legs or anywhere. Whereas bryonia will mostly act on the serous membranes. It will give those stitching pains mostly of that those areas. Next is that the key seat of affection for Kalikab is mentioned as lower right chest and it goes to the back. And all cases where you have failed giving Bryonia and now you are thinking what to give next, Kalikab is the next remedy. So this is the beautiful part where he gives the relationship of the remedies as well in sharing about the key features of the remedy. And what is interesting is that he also shares about mercurius group of remedies, how you will differentiate bryonia, kalikab, and mercurius in a case where there is similar appearance of symptoms, and this will happen with most of you. So he goes on to explain that kalikab has more or less key stitching pains, which he explained, and there is profuse sweating, which is uh, you know cannot give him any relief. Usually people get better with sweat if the sweat comes out, but here the patient is weakened by sweat. Which patients will get better by sweat? You will see sorinum, you will see natrum mure, and some other remedies, but kali carb is a remedy which will get worse with the sweat. And what you will see is that kali carb influences the blood making process. So those who are thinking that all patients with low hemoglobin, low blood counts require hematinics should think doubly. and give a chance to Kali Carb for it to work, because Kali Carb is going to influence the blood making process from the age of young babies till the age of puberty, or afterwards also Kali Carb works well, which is what uh, Dr. Nash has shared. There are many homeopaths who would be giving pulsatilla, ferrum phos, ferrum met for all the cases of anemia, for all the cases where blood is less or blood count is affected, and you will more or less fail because you have not taken a case in full totality. That's where Kalika will come into picture and work really well. It also has key features of anemia with bag like swelling of the upper eyelids. We know about it. And the patient, if you are a very keen observer, very good observer, you will see that the patient enters and drops in the chair rather than just kind of sits properly. So that will be your observation. It is not something that the patient will tell you that I am dropping in the chair every time wherever I go. You will have to observe that. Once you observe that, you will make yourself more comfortable with such observations and prescribing remedies based upon that. Next, he gives a very nice case of how there was cavity in the lungs, and how there was, Kali Cup, which helped the case. You should go and read about this particular case. And then consequently, he gives another similar case where there was lot of dropsy. Patient was supposed to die because of that dropsy, but he lived for another 20-30 years. He didn't die of dropsy, and Kalika was the remedy that helped him. So all those who have doubts about how homeopathy works, all those who have doubts about how remedies need to be given, they need to get inspired by these different cases of different remedies from the Nash leaders in homeopathic therapeutics by Dr. Nash. That will give you the good inspiration to take your practice further. Next, what he says is that there is great debility, easily frightened persons, and sensitive to anything, especially they feel every sensitivity is localizing in the epigastric region. There will be a class of people, for example, arsenic, aconite, phosphorus, who will tell you that there is kind of a anxiety I feel in the chest region. Phosphorus, in fact, will tell you that there is anxiety in the chest region. But Kalikab is a person who will tell you, no, something is I feel over here in the bottom, in the center of my trunk. That is where your epigastrium is. And if you try to, ask the patient by confirming this type of question, it is going to help you a lot. Going further, we have uh, next remedy, which is Kali bichromicum, and he shares that there is more or less Kali bichromicum in cases of mucous membranes, tough, stringy, adherent mucus, and he compares the remedy Kali bichromicum with hydrastis, with lycinum, and with iris versicolor. And he gives very beautiful two cases from Nash about a woman and a dog who had some different affections, and how he gave Kali bichromicum and it helped. Next, what Nash gives is that there is a kind of a distress immediately after eating. So all those patients who have gastroesophageal reflux disease, they need to be given a dose or two of Kali bichromicum, because the upper GIT tract is more prone to get affected by the recent food intake, which is where Kali bichromicum will be the remedy that you will think of. Distress, which is immediately after eating, stomach ulcers will have more or less been helped by Kali bichromicum by Dr. Nash, and you can find in the different authors as well, they have mentioned it. Dr. Nash compares Kali bichromicum with Nux moscata and also with anacardium with Nux vomica. So you will have to, finely differentiate the modalities. Is it aggravation immediately after food, or 2 to 3 hours after food, which is going to cause the distress to the patient? That's where you can think of immediately after food, Nux moscata, Kali bichromicum. If it is few minutes afterwards or few hours afterward, it is nux vomica, it is anacardium. And kali bichromicum, no doubt, again we all know about it, that's how it is affecting the small spots, and the pains are wandering or the affections are wandering. Kali sulf, pulsatilla leg can have been similarly mentioned by Dr. Nash, and you can read the different literatures of how these remedies are going to work that way. People who are light-haired, children disposed to Qatar, many children who have recurrent URTI, upper respiratory tract infection, Kali bichromicum will be the remedy which will be required as an intermittent remedy in between for the acute conditions, along with the chronic remedy which is going on. It can be calcarea, phosphorus, or calcarea phos, or silica, or kali carb, or lycopodium, something like that, which is constantly going on in the background, like one dose every 1 month or 2 months, and some intermittent bouts of recurrent URTI. Either it can be helped with the constitutional remedy, or you need to give some acute remedy, which is Kali bichromicum, that will help you. The third remedy for the day, which Nash explains you, is that Kali iode, and he says that this remedy has been very badly abused by many doctors, allopaths, homeopaths, similar to the China officinalis. And what he says is that after long standing chest troubles, if the cough is not going, then you can think of this remedy. It is going to help all such patients where the cough is a consequence and not it is just the presenting symptom of a disease. And then he shares something which is the most valuable things I've come across from his entire book, some pieces of information of how Dr. Nash started his practice, how he employed Kali iodatum in the beginning of his practice, and how he experimented with the 200 potency. Yes, so all the homeopaths who are starting their practice, somewhere they need to experiment with higher and higher potency, and they are afraid to go higher because they feel that the patient will have an aggravation. But for Nash, 200 was the highest potency. How he experimented, how he employed and gave results and got the confidence. You need to read Nash to understand it. He compares Kali iode with sanguinaria and sternum met, especially in cases of expectoration. For example, he gives that sternum met will have sweet expectorations, sanguinaria will have fetid expectorations and odor, whereas Kali iode will have frothy or soap sud like expectorations, which is almost like sepia as a discharge, you see. And how you will see that many patients who require aconite and belladonna in the initial levels of their presenting of symptoms, you have a case which is, looks like he is going to localize in a particular organ, nasal passage, head, throat, and you have given belladonna, and probably the range of belladonna has gone, or the range of action, or suppose the patient is rapidly progressing into many layers of inflammation, congestion, and interstitial inflammation. That's where, after belladonna fails, kali iode needs to be given. This is what Dr. Nash shares in his book, Leaders in Homeopathic Therapeutics, and that's where you need to read. He not only gives materia medica of a remedy, he gives different ideas of what to do when a remedy is failed, what to do when a potency has failed, and how you can get an inspiration from the different cases that he gives. In Kali Iode, he gives very beautiful two cases, and also how he experimented with, beginning of his practice with different potencies, and how many times he repeated, how he repeated. That's what he has shared. So last but not the least, and we come to the remedy Kali muriaticum. Second stages of inflammation, all the homeopaths know about it. There is interstitial exudation. There is a phase where you have already given aconite, belladonna, or ferrum metallicum, ferrum phos, and you don't know what to do now. That's where you can step into picture with the second stage remedies, which is Kali Mur, Kali Sulf, and in fact Kali Iode as well. So Kali Mur, he gives that this is a remedy which he used to prescribe in the 24th potency. So can you imagine? We all fear 200 potency, 38 potency, but he used to prescribe in 24th potency. In fact, he used to make medicines on his own also at times to kind of potentize them. So he had used Calimure in the 6th and the 12th potencies, but he some cases he didn't find good results. That's where he progressed into 24th and 30th potency and he found good results. What Dr. Nash says is that Kali muriaticum is very much similar to Merck dulcis in many of the symptoms, so you will need to differentiate. And we have already done Merck dulcis few days ago. You can go through the sessions to understand how Dr. Nash shared about that. In fact, if it is not Merck dulcis per se, it would be Merck core or Merck sol as a remedy, and we have the similar features. So Ali Mediaticum, he says that he solved cases of acute rheumatism with Kali Mediaticum, especially 24th potency. Can you believe it? And we are struggling in our clinics with different types of rheumatic cases. And Dr. Nash gives us a blueprint to succeed with certain potencies that he used, certain repetitions that he prescribed in those cases. So I would urge all readers to all viewers to go and become readers of Leaders in Homeopathic Therapeutics by Nash. Kali muriaticum, he gives last explanation is that this remedy is something that has come more into practice by clinical introduction rather than provings, and that is what Herring calls it, that it is a remedy born by breach presentation. So very beautiful in analogies he gives in the different remedies, and how we can take inspiration from those remedies and take our practice further. That is what is given in Dr. Nash's Leaders in Homeopathic Therapeutics. I hope you got some idea of what you need to do, how you need to do from this session. And if there are any questions, please feel free to drop by, or else we call it a day. And we'll meet up tomorrow again, evening 5 p.m., with another set of 5 remedies from Nash.